Ankylosing spondylitis is an interesting condition that sometimes gets misdiagnosed for years and leaves patients with a lot of questions, and is one that is very treatable. And I have an interesting case that I saw recently that I'd like to discuss to exemplify some of those issues. So this was a recent case that I saw, a 43-year-old man, South Asian descent, who was coming in with a history of chronic pain and stiffness in his lower back and his neck. His stiffness was significant, lasting for hours every single morning, and he had mild to moderate pains. Along the way, he was diagnosed with ankylosing spondylitis by another rheumatologist and was coming to me because he had some questions, some concerns, and really wanted a second opinion about a few different things. So in his case, his other kind of pertinent factors included he had classic inflammatory back pain symptoms, meaning very prominent stiffness in the morning, pains that were worse first thing in the morning and with rest, better with activity. Pains had been going on for 15 years plus, so started when he was younger. In addition, his testing showed that he had a mild degree of inflammation on labs based on his SED-rated CRP test. His HLA-B27 test was actually negative, and he had a very pertinent MRI that showed changes in the SI joints, which I'll talk a little bit more in a moment. So from a clinical presentation, he had very classic ankylosing spondylitis from my perspective. And so the questions he came with were as follows. Number one was, does he really truly have ankylosing spondylitis? So here's how we came to his diagnosis. In an individual who had symptoms that had started in his late 20s, presenting with classic inflammatory back pain symptoms, meaning prominent stiffness in the morning, symptoms worse with rest, better with activity. Family history of ankylosing spondylitis. I didn't mention that before, but father has ankylosing spondylitis as well. And an MRI that showed prominent chronic changes in the SI joints, namely that both SI joints had partial fusion findings. He really meets pretty classic diagnostic criteria for that diagnosis, ankylosing spondylitis. So I agreed with his diagnosis that was already given to him by another rheumatologist. His next question was, well, what about his HLA-B27 test? It was negative. So the HLA-B27 test is a genetic marker that has an association with ankylosing spondylitis. Now understand that about 6 to 8% of the population, general population, can be HLA-B27 test positive, but only a small minority of those people will actually go on to develop ankylosing spondylitis. So not having the HLA-B27 test does not rule you out from having AS. It's just another risk factor there. So in his case, I didn't think that was too important. He did have some other lab tests that did show some mild inflammation that I think fits with his diagnosis of a chronic autoimmune condition causing total body inflammation. His next question was, well, what about his MRI findings? So on his MRI findings, he had a couple things that were interesting. He had some mild early degenerative changes, which based on his history and exam, I didn't think explained his actual pain and symptoms. His SI joints did have evidence of partial fusion on both sides. That's something that you can see in ankylosing spondylitis that has progressed over time. So very pertinent in his case. Not just one side, actually happening on both sides. Again, classic for AS. Now his MRI did not show the classic inflammation in the SI joints, meaning bone marrow edema around the joint. But again, with his fusion findings, I thought that was adequate for ankylosing spondylitis diagnosis. And then he had some other questions as well. His kind of big question was, look, he'd been recommended a biologic treatment, a stronger treatment for treating AS. And he wanted to know, are there alternatives? And he was specifically asking about some Regenerative treatments. Now, in his case, it's kind of interesting because his pain was relatively mild. And so, he wanted to know, is a alternative treatment one that would make sense in his case? And in my opinion, when you look at the data available, when you talk about disease modifying, preventing progression of disease, realistically, it's just the medications, the biologic treatments. You should 100% maximize everything else diet, exercise, supplements, of course, do all that. None of that is disease modifying though, proven to be disease modifying. The Regenerative treatments can help with pain, things like platelet-rich plasma or bone marrow cells, but no evidence that they are really disease modifying long term. The only things that are really truly disease modifying are the medications, the biologic medications. And in his case, very pertinent because on his MRI, he already has findings of damage and early partial fusion in the SI joint. So he's already past that early stage on imaging findings. He's actually already at the moderate stage. And he has a high risk of that progressing because of what he's already developed. In addition, he has a family history. His father has had progressive AS to the point where he's lost really almost all range of motion in his neck. And this was a case where he could literally see what his future could be if he doesn't pursue treatment at this point. And then the last part of this was, something for myself here. To me, this was a case where I thought if you looked at him, this seemed like a pretty straightforward case of ankylosing spondylitis and what was the next right treatment for him. For my own curiosity, I typed this into Open Evidence. This is an artificial intelligence and AI software that's pretty interesting, that is actually very helpful, and a lot of doctors find it kind of curious and helpful and actually interesting. And for the most part it is, but when I typed in his case and I asked it, what would you consider would be the first line treatment? The AI here said using NSAIDs, ibuprofen, Advil, Aleve, because that is traditionally what has been the first line option for ankylosing spondylitis for treating pain. In his case though, just a little bit more detail, meaning if you understood what his goal was, how do you prevent progression like his dad has had? You realize that he doesn't have a ton of pain. What he has is concern for progression because he already has a moderate degree of progression on his MRI imaging, in which case biologic treatments were the right treatment in his case. So I think AI has a great deal of future in medicine and interaction with patients and even helping to care for patients, but at least in this case, wasn't quite up to snuff, was not actually accurate. Part of that was, I guess I did have more direct interaction with this individual, with the patient, where I sort of knew exactly what the real issues really were for him and his overall case. But I think as humans, we still have a role as doctors, cannot quite be replaced by technology at this point.